A tracheostomy is a surgical procedure that creates a hole at the front of the neck and into the windpipe. This hole provides a passage to the lungs to help you breathe. A tracheostomy tube is placed into this hole to keep it open for breathing. A neck strap keeps the tube from slipping out of the hole. A tracheostomy is needed when medical conditions make it necessary to use a breathing machine or ventilator over an extended period of time, or when health issues cause muscle weakness or paralysis that makes it difficult to clear phlegm and saliva from the throat, or when there is a situation where the airway becomes narrow or blocked. When you no longer need the tracheostomy tube is removed and the hole is allowed to heal shut or is surgically closed. For some people, a tracheostomy is permanent. Because having a tracheostomy tube can affect a person's ability to speak and swallow, speech therapists help these people with tracheostomies with their communication and swallowing. In some cases, speech therapists work in a team that weans individuals off the tracheostomy tube. Most patients will have a tracheostomy tube that has an outer tube and an inner tube. The outer tube keeps the hole open. The inner tube that fits inside can be removed for cleaning. To secure the inner tube, insert the inner tube and twist clockwise until you feel a click. To remove the inner tube, securely hold the outer tube or neck plate with one hand and using the other hand, twist the inner tube anti-clockwise and pull out gently from the outer tube. Tracheostomy tubes with holes or fenestrations are designed to direct more air to the upper airway, and this makes speech easier. If you have this type of tracheostomy tube, you will be provided with two different inner tubes, one with a hole or fenestration and the other one without. You should always use the inner tube without the fenestration for suctioning to avoid injuring the tissue in your breathing passage. While you are in hospital, you and your carers will learn and practice skills necessary for maintaining and coping with your tracheostomy. You may want to write using a pen and paper or text on a mobile device to help you express your needs and wants at this time. Speech therapists can help persons who are unable to read or write by providing picture communication boards or recommending alternative communication devices. Nurses will teach you and your carers how to change the dressing around the tracheostomy tube and to clean the inner tube to prevent infection and to reduce the risk of complications. You will need to do this as long as you have a tracheostomy. Some patients will also learn how to use a suction machine to help remove secretions or phlegm from the throat or the airway. The air you breathe in will be drier because it no longer passes through your moist nose and throat before reaching your lungs. This can cause irritation, coughing, and increase secretions. You may wish to use a humidifier that adds moisture to the air in a room. How does a tracheostomy tube affect voice and speech?
First, let's learn about how speech is normally produced. As we breathe out, air from our lungs will travel upwards along the airway towards the voice box located here, where voice is produced. The voice continues traveling up through the throat and out of the mouth. The mouth shapes the voice into different speech sounds, allowing us to speak. A tracheostomy tube is used to help a person breathe. Instead of breathing in and out through the nose, air moves in and out of the tube. However, this interferes with a person's ability to speak. This is because when a person breathes out, the air from the lungs ends up traveling through and out of the tube. As a result, the air does not pass through the voice box, and so no voice can be produced and the person is unable to speak.
Speech therapists can also teach techniques and prescribe devices to redirect airflow so that individuals with a tracheostomy can speak. Depending on the type of tube and the condition of your vocal tract, you may be able to speak using two methods. One method is to close off the end of the tracheostomy tube simply by using your thumb or finger. This method requires coordination of your breathing and the timing of closing off the tracheostomy tube with your thumb or finger. Coordination can be difficult in the initial stages, and your speech therapist will teach you how to coordinate talking and breathing and will help you to practice. How do you use and care for your speaking valve?
While a person can speak by covering the end of the tube with a finger, a hands-free option will be to use a speaking valve. A speaking valve is a one-way valve that is inserted at the exposed end of the tube, which allows air to flow in only one direction.
Suctioning should be performed immediately before the use of a speaking valve if you need it. Before using a speaking valve, make sure that you are using the fenestrated inner cannula together with the speaking valve, and make sure that the inner cannula is clean and free of secretions or phlegm. Inspect your speaking valve to ensure that there are no secretions stuck in the flap of the speaking valve. If any secretions are stuck in the speaking valve flap, wash the valve with warm soapy water and air dry it. Do not sterilize or use alcohol to clean your speaking valve. When you have the clean fenestrated inner cannula in place and a clean speaking valve ready, place the speaking valve onto the end of the tracheostomy tube with a gentle twist. Observe the speaking valve to ensure that the flap opens or moves when you inhale.
When you breathe in, the valve is open. Air enters into the tube and travels down the airway towards the lungs. However, when you breathe out, the valve is closed, so air travels through the trach tube and fenestration towards the voice box. Voice can be produced and shaped to produce speech. This allows a person to speak without having to use their fingers to cover the trach tube.
To remove the speaking valve, gently twist it off, making sure that the inner tracheostomy tube remains firmly in place. After using the speaking valve, it should be cleaned. Swish the valve in warm soapy water, then rinse the speaking valve under running water and shake excess water off. Place the valve in a clean place and allow it to air dry. The valve should be replaced after 2 months of use, or if it becomes sticky, noisy, or produce other sounds when you speak. You should contact your doctor or speech therapist when the valve needs replacing, or if you have any questions about using the speaking valve. When you are using the speaking valve and after placing it on, you find yourself unable to produce voice or sound, remove it immediately. Try to cough out any secretions or phlegm or suction this out before trying the valve back on again. If you are still unable to make a voice, consult your speech therapist or ENT doctor. When using the speaking valve and you find yourself short of breath, have breathing difficulties, or a very fast heart rate, remove the speaking valve immediately. You should also visit the nearest accident and emergency department if you find yourself having breathing difficulties, a very fast heart rate, or shortness of breath even without your speaking valve in place. It is possible to eat and to swallow with a tracheostomy tube in place. After the tracheostomy tube is first inserted, swallowing can be difficult, and you may need to receive nutrients through an intravenous line or a feeding tube that passes through your nose into your stomach. Patients with a tracheostomy tube are at higher risk of aspiration, that is, food or drink entering the airway. Swallowing can become weaker if the person has not eaten for some time. The presence of the tracheostomy tube can also reduce the movements needed for safe and effective swallowing. People with tracheostomy tubes may also be less sensitive to when food or drink enters into the airway. However, there are patients with tracheostomy tubes who are still able to eat and drink normally.
To help a person with a trach speak, A fenestrated tube can be used. A fenestrated tube has a hole at the back to allow air to pass through it.
When you are ready to eat again, you will need to work with a speech therapist who will assess your swallowing and help you regain the muscle strength and coordination needed for swallowing. If you are discharged with a tracheostomy tube, keep your scheduled appointments with your doctors to monitor for possible complications. If you experience severe bleeding from the tracheostomy tube or around the tube, or you experience difficulty breathing, or there is pain around the tracheostomy site, or redness or swelling, you should visit your nearest accident and emergency department. In most cases, a tracheostomy is temporary, providing an alternative breathing route until medical issues are resolved. If you need to remain connected to a breathing machine or a ventilator in the long term, the tracheostomy is often a good long-term solution. Your healthcare team will help you to determine when it is appropriate to remove the tracheostomy tube. If you have any difficulties or concerns about your tracheostomy, about the use and care of your tracheostomy tube, or have concerns about removing your tracheostomy tube, please seek the advice of your doctor or help from your healthcare team. We hope that this video has helped you to learn more about your tracheostomy tube and how to care for it. Please inform or speak to your speech therapist if you have any questions.